Women are the pillars of every Indian family. More so in rural areas, where behind every happy family is a healthy woman. Lifestyle across rural India is largely centered around and dependent on women. Where men go out to earn their livelihood and women stay at home to take care of everyday household matters, and sometimes even have to step out of home to run necessary errands or attend to odd jobs. In this everyday busy schedule, women tend to avoid or overlook delicate health issues, either because of ignorance or negligence or because of social taboo. Breast cancer is one such disease that today has become a global issue, with increasing occurrences in India as well, raising serious health concerns in vast remote rural areas, and specifically when faced by challenges of lack of awareness within the women folk. One such thoughtful initiative by Aaroogya, Carnage Breast Cancer, is in creating and spreading wider awareness on breast cancer on a socially persistent national level.
Breast cancer is the commonest cancer worldwide in females. So that is why we always say that which is the commonest cancer, you must do early detection and aim at cure, not aim at palliation. Early detection is the hallmark to cure. So Aaroogya is one of the NGO which has been doing cancer awareness campaign, because awareness is lacking in India.
Aaroogya, the brainchild of Dr. Priyanjali Datta, in association with Grameen Healthcare, is working tirelessly across India for better awareness, early patient diagnosis and follow-ups on breast cancer. To understand the entire ecosystem of the targeted population in the sugarcane belt of western UP, 800 villages by the bank of River Hindon has got very toxic, thereby producing harmful farm products which are consumed by the entire mass rural population and also supplied in urban localities. This survey records individuals' lifestyle, socio-economic background, stress levels, general health conditions, existing healthcare scenario in those villages, and finally about breast cancer.
The team of Aaroogya are working here for breast cancer awareness, and we have a very comprehensive and holistic survey, digital survey that we are doing here on Google Forms. But seeing the basic infrastructure, the preventive and the primary health care of each village, I have realized that there are not even basic shops of medical facilities with basic medical care. So I think Aaroogya and its team of research analysts are working very hard towards it, with all the digital survey forms and clinical checkups and mobilization of patients for the disease detection. But with the absence of preventive and public health care in these remote villages, reaching India's dream of a healthy India is distant.
A first in India, Aaroogya has initiated real-time digital data collection of surveys shared instantly with strategic partner Eximius Health. Data scientists analyze the data received and create a report for evaluating and assessing public health status in India. Aaroogya today works incessantly in the remote rural belts of India, where the social barriers remain a hindrance. Aaroogya's comprehensive anthropological approach to understand and solve the social restrictions and taboos right from the root.
You have to understand where people come from if you want to help them. We cannot treat a disease, a targeted disease, without understanding who are the people. What do they know about health? What are their life conditions? How is their everyday life going? How do we introduce them the notion of awareness to health, of care, of awareness of the others? How do you take people of different levels of segments of the population and make them all understand better what are diseases in general? Because I think there is no one cancer. There is a holistic view of human life.
Aaroogya has facilitated the rural population with remote healthcare counseling and treatment by renowned doctors through telemedicine, a telecommunication technology, a non-profit initiative.
For Women on Wings, I travel a lot to the rural pockets of India. Our focus of Women on Wings is to co-create 1 million jobs for women in rural India. Next to that, when the woman gets a better income, means that she also gets better receptive for all other social changes in the community as well. And that's exactly, I think, where Aaroogya comes around the corner. Because when the women evolve and they develop in a further way, they are also more receptive, because then it's also about education, it's about health, it's about sanitation. And we believe that these kind of things only can find a fertile soil when the economic development is there as well.
So I act as a mentor and like an advisor to Priyanjali and her NGO Aaroogya, which is exciting. So Aaroogya is not just a conventional NGO, it is a holistic concept of incorporating social innovation ideas to democratize preventive healthcare in public health domain.
Aaroogya is a thoughtful initiative that continues to take unprecedented steps in empowering women with awareness to carnage breast cancer and to bring smiles across millions. Aaroogya, our revolution in India's healthcare system.